Hello and welcome to Historical Healthcare Markers Timeline. This is a presentation by Grace Villarreal. What is involved in the delivery of healthcare in the United States? Here in the U.S., it has a unique system of healthcare delivery. For this presentation, healthcare delivery will refer to the major pieces of the system and the processes that enable people to receive health care. It will be the undertaking of providing health care and the systems and processes involved in delivering that health care. America became increasingly urbanized in the mid-1800s. Hospitals, first built by city governments to treat the poor, began treating the not-so-poor. That's Randolph from 2009. So hospitals have become pivotal in the U.S. health care delivery system in the 1800s. Now this is a place where it's not just for the poor, but wealthier people are coming to hospitals and are being serviced. As the delivery of health care advanced, there are new institutions and organizations that formed alongside hospital institutions. Now we see the rise of home health care. Also, there are nursing homes and even hospice care. They are becoming now more important in the medical field and in the delivery of the systems of medicine. Well, as the hospitals continue to deliver health care, the professionalization of doctors makes a big impact in that delivery system. In the early American colonies, the role of a doctor was more informal. In 1765, the opening of the first medical college by the University of Pennsylvania was really important. In the 19th century, you see the utilization of other sciences in medicine. Sciences such as chemistry and other types of sciences are now being utilized to diagnose patients. 1846 is the creation of the American Medical Association. This AMA provided physicians with influence and protection. The reputation of providers became more prestigious. Now, doctors had prestige, and even wealthy people had confidence in these doctors. So the delivery of health care just continued to grow. Another important measure was 1910. This is an important marker where Flexner Report established guidelines for admission, testing, and curriculum for medical schools. Another important marker that was pivotal was the rise of the health insurance. In the 1860s, is the first private insurance plan originates in the United States. It's actually created to help with the costs associated with the Civil War. Then in the 1920s, employers' group health plans start to rise. 1930s, Blue Cross and Blue Shield allowed its members to pay both the cost of hospitalization and for treatment by physicians. This is a really big impact in healthcare. Then the 1930s brings us again the Social Security Act, which is signed by President Roosevelt. And in 1965, Medicare and Medicaid was signed into law by President Johnson, all leading to some major changes. More legislation continues to be passed into law. In 1993, the Family Medical Leave, or the FMLA, is created to provide protection to family members that need to take time off or people that need to take time off because of medical issues and have some protection of their jobs. And there's 2000, you have the Children's Health Insurance Program that was established to protect children. And then in 2010, you have the Patient Protection and Affordable Act, which is signed into law by President Barack Obama in March of 2010, which included provisions that required most individuals to secure health insurance or pay fines. It made coverage easier and less costly to obtain, it cracked down on abusive insurance practices, and it attempted to rein in the rising cost of healthcare. The PPACA was widely considered the most far-reaching healthcare reform act since the passage of Medicare, which was a U.S. government program guaranteeing health insurance for the elderly. This piece of legislation came into being at a time when almost 45 million people were uninsured. Now we have advancement in medicine. In 1846, we see the use of anesthesia and a new frontier in medicine. 1895, the X-ray was discovered. 1950s, we see the rise of the mechanical heart. And the 1970s gave us a CT scanner, insulin pump, and the MRI. As we fast forward into the 1980s and 1990s, the synthetic blood and DNA sequencing is now part of life, all adding to creating this healthcare delivery system. Now the next marker is a managed care or health management organization, HMO. In the 1980s, the HMO came into existence in response to the high cost of healthcare. By the 1990s, HMOs began to control much of the way doctors and hospitals are reimbursed. Fee-for-service was slowly being replaced by capitation, a system that paid doctors a set fee from which they had to care for all of their patients, the sick and the well. Called managed care, the system also produced changes in the consumer's role in health care, as greater emphasis was placed on preventative medicine, consumer choice, and being accountable for one's own health and health care. In conclusion, I've outlined the progression of the healthcare delivery system in the United States through the various markers of the system. Each of the markers have worked together to create the system that we currently have. From the creation of the early hospital in the 19th century to the professionalization of doctors and the cost of medical treatment combined with advancement in medical technology, the development of healthcare insurance with key legislation and managed care. We should have reason to believe that the future of healthcare delivery looks optimistic. Technology will play a bigger role in terms of seeking medical care and advice and preventative care. And it will lower medical cost as well, as communication between hospitals and medical offices will improve with the adoption of the electronic healthcare records. And this is according to the Kaiser Permanente CEO Bernard J. Tyson. The 21st century technology promises to continue changing the nature, complexity, and cost of healthcare. As knowledge increases about the genetic basis of diseases, the healthcare system will make greater use of gene therapies, develop ways to prevent genetically caused diseases, just as the impact of new technologies, such as X-rays, antibiotics, vaccines, and surgical advances changed early and mid-century medicine socially and scientifically. Scientific and medical innovations, as well as social movements and economic realities, will continue to shape 21st century medicine and healthcare. This concludes my presentation of the healthcare markers timeline. Thank you for listening. I appreciate it. Have a good day.